Hi, my name is Sherry Hughes, and I'm here today with Michael Berger to talk about the e-prescribing impact on Medicare Part D migration to NCP script version 201701. Mike is a senior consultant with Point of Care Partners. Hi, Mike. Thanks for joining us here today.
Thanks, Sherry.
Sure. Mike, can you tell me about the change to Medicare Part D and NCP DP script?
Sure. So Medicare Part D has announced their final rule requiring adoption of NCPDP script version 2017-01 for electronic prescribing effective on January 1st of 2020. That simultaneously will retire the existing version of script version 10.6.
Okay. There are several things we want to know about the new Medicare Part D update. Can you first share who must use the new standards?
So the changeover applies to prescribers and dispensers who electronically transmit prescriptions for Medicare Part D beneficiaries, either directly or through an intermediary like SureScripts.
What transactions are included in the Part D update?
Well, in addition to all the transactions that are in version 10.6, there's a couple of new ones. All of them are optional, as none required, but nonetheless there are a number to choose from, including things like new prescription requests, prescription transfer messages, and there are a few regarding REMS, risk evaluation and mitigation strategy.
Mike, is everyone required to use the new transactions?
No. The way this regulation works is that if the stakeholders, the prescribers, and the receivers of the transaction choose to adopt these transactions, then they must use NCPDP script version 2017-01, and that's only for Medicare Part D beneficiaries. Also, it's important to note that what Medicare mandates is typically the bellwether for the rest of the industry, so you'll see the commercial insurers and the others in the industry follow suit as Medicare rules are implemented. It's also interesting to note the focus on the REMS transactions. Even though there's relatively few prescriptions that require REMS, there's definitely a focus around patient safety, and so it's clear that CMS is anxious to implement REMS electronically to promote safety prescribing.
Great. Well, what is the implementation date for the new Part D changeover?
So CMS has proclaimed that the changeover applies to the Part D contract year that starts on January 1st of 2020. The trading partners and business associates certainly could adopt the new transaction standard earlier, but it absolutely needs to be done by January 1st of 2020.
Well, what does this changeover mean?
Well, changeovers to new standards are always challenging. There's no question about it. And a 2-year time frame may be considered by some of the stakeholders to be a pretty short window. Nonetheless, the 2 years is enough time for all of the stakeholders to plan ahead to decide which of the new transactions, if any, they wish to support, as well as to understand the enhancements that are needed to existing transactions that are in play today. That'll give plenty of time for quality assurance testing. Also, CMS announced that harmonization between the EHR certification process will happen. So that means that certification for the new transaction standards, as well as for script 2017-01, will all happen simultaneously, which is a good thing because the participants will only have to certify once as opposed to multiple times for the same types of transactions.
What if a stakeholder has already implemented the script?
Well, version 10.6 has been around for a number of years, and virtually everybody that does e-prescribing uses script version 10.6. So even if you don't intend to implement any of the new transaction types that are in 2017-01, there's still advantages, not to mention the regulatory requirement of moving to the new version. For example, there are clarifications and improvements to many of the transactions that have been in 10.6 for years. For example, one of the streamlined transactions is the quantity units of measure, where they have pared down the number of codes that are valid to just a handful. That one change alone will eliminate thousands of phone calls from pharmacy to prescriber for clarification of the prescriber's intent. And so the effect on patient safety of concise and unambiguous prescriptions is very clear.
Mm. Mike, what can you tell us about the full implementation of script 201-701?
So, of course, the implementation of the new transaction types will largely depend on business cases. If there's no business case, we don't expect that any of the industry stakeholders are going to support the transaction unless it becomes required. And that applies not only to the new transactions that are in 2017-01, but also to some of them that were in 10.6. So one transaction for which a use case exists is the pharmacy requirement to notify the prescriber when they've substituted a biosimilar. And that's something that's a regulatory requirement today in 41 states plus Puerto Rico. So that's one that makes sense. There's a business case for it. We also understand that a number of the pharmacy chains have plans to implement RX change, cancel, and transfer, so a business case exists for those as well. There's another one, RX fill, for example, which really doesn't have an understandable business case. And so we believe that in that case, a revenue model or an incentive is probably going to be necessary for the industry to adopt it.
Mike, thanks so much for joining me here today and sharing the valuable information about the new Medicare Part D update. If people want to know more information, how can they contact you?
Well, NCPDP script 10.6 has been around for a long time. It was approved in 2012 and implemented in 2015. The world has certainly changed a lot since then, so it makes sense to update to the latest version of the standard to keep up with what's going on in healthcare. I can be reached for further information at michael.berger@pocp.com. Thanks, everyone.
Thanks, Mike.